What's she doing?
Changing the world, one template at a time. Hi, my name is Sunita Lewis, and I'm a public health nurse. I'm also a DNP FNP student, and my DNP project focuses on everything that a nurse understands: documentation. I chose this project because when I first started working at public health and was being precepted, I noticed that something that really stood out to me. There was no clear guideline or standardized way to document care for our TB patients. I remember asking, where's a template or where's a checklist for what we should include? And I realized that every nurse charted inconsistently. It felt like such an important issue, but also one that could easily be addressed in a practical way. Implementing a standardized documentation template could improve accuracy, safety, and continuity of care for both our nurses and patients. I saw this as an opportunity to bring in evidence-based research and use it to create change within our TB program. A simple improvement that could have a lasting impact on quality and patient outcomes. Here's the problem. Every nurse charts differently. Some write novels, some write 3 words. That inconsistency can not only affect patient safety and public health outcomes, but it also puts the nurses at risk. My PICO question is, among field nurses, does implementing a structured assessment documentation screening tool and training education compared to current practice documentation improve initial assessment documentation? Basically, I'm testing if organized documentation makes nursing life less chaotic. Spoiler, it does. For the deployment of my DNP project, I plan to improve tuberculosis documentation through a standardized charting template for field nurses. I'll collaborate with another county that already uses a TB template to identify key elements that support accurate, consistent documentation. With our director of nursing, we'll adapt those components and define mandatory queries like demographics, exposure history, labs, and treatment follow-up. The director will complete a baseline audit of current charts, then I'll provide training for field nurses on the new template. As new TB cases are charted, a follow-up audit will evaluate improvements in accuracy and consistency. This cycle of collaboration, education, and evaluation will show whether or not standardization truly strengthens the quality of TB documentation. The foundation of my DNP project comes from the evidence showing that standardized documentation tools lead to measurable improvements in accuracy, communication, and overall patient safety. Multiple studies across acute care settings have demonstrated that when nurses follow structured templates, there are fewer documentation errors and better continuity of care. By applying those same principles to TB documentation, we are able to customize it to meet the needs of our specific program within our county and patient population. Evidence-based practice also emphasizes ongoing evaluation. By auditing documentation before and after implementation, we'll be able to determine if the standardized template truly leads to better documentation quality. These findings can then contribute back to the body of evidence and guide broader public health practices. This project uses data, research, and clinical judgment to improve outcomes. It's about closing the gap between what we know and what we do, ensuring that every chart reflects the highest standard of care. This project also focuses on strengthening our culture of safety within nursing and public health practice. By introducing a standardized TB documentation template, nurses follow the same structure for every case. This consistency improves accuracy, reduces variation, and makes communication across the care team much more clear. This ultimately supports both patient safety and nursing accountability. This project also aligns with social justice and health equity. TB continues to impact vulnerable and underserved communities, and inconsistent documentation can unintentionally widen those gaps. Standardizing how we document allows us to track outcomes, identify disparities, and make sure every patient receives the same quality of care. So while it starts with documentation, it's really about consistency and improving outcomes for our community. Of course, every great project has its challenges. Some nurses might feel resistant to change or worry about extra workload.
This is just too much work.
To address this, I'll engage the staff early. I'll highlight the template's benefits, and I'll provide ongoing support. Simple education tools and feedback loops can make things so much more simpler and sustainable. By improving TB documentation, we're improving communication, safety, and patient outcomes, not only for nurses, but for our patients.